Hi, Dr. Brian Heaberlin here with Lexington ENT and Allergy, and I want to talk about endoscopic sinus surgery today. Endoscopic sinus surgery is a very common operation that's performed to try to help open up people's sinus passages, to reduce drainage, try to reduce the number of recurrent infections people have, sometimes reduce the facial pain and pressure that goes along with sinus disease. Sinus surgery typically takes about an hour to an hour and a half to do. And we often couple this with septoplasties if people's septum's crooked to try to help improve airflow through the nose, or turbinate reduction to try to help improve airflow through the nose. So sometimes people don't know exactly what we're doing inside, but we're doing things to try to help open up things, both with their breathing and with opening up their sinuses to reduce those infections and problems. Afterwards, people, if they have a septoplasty, are going to have some splints in their nose, but if they don't have a septoplasty, typically aren't going to require any nasal splints. I use some absorbable nasal packing material. It's kind of a foamy material that goes up in the upper part of the nasal passage, but it's not down where most of our nasal breathing is. So if you don't have a septoplasty, most people can breathe reasonably well immediately after surgery. Although if you have a septoplasty, the splints are going to partially obstruct the ability to breathe after the surgery. Now, it's very important in how people keep the nose clean to help them heal properly after sinus surgery. So I like people to do a sinus rinse, and so you can get these sinus rinse bottles at any drugstore. This is one by a company called NeilMed, but you can get any brand, but this is a pretty good one. I like people to flush their nose out 3 times a day. We don't want people blowing their nose after sinus surgery, so the flushes act as a way to help keep things open and keep them clean and try to reduce the need to blow the nose. That absorbable packing material that I place in the nose is going to be something that absorbs over the first week. I usually see people back about a week after the surgery to clean out some of the clots and scabs that everyone's going to have in their nose, so that they can breathe better and so that it can stay cleaner and reduce the chances of infections post-operatively. People are going to need some pain medications. Typically, they're usually going to be on some antibiotics, and I often place people on some steroids afterwards to try to help reduce some of the inflammation and things that occur naturally after sinus surgery. Now, sinus surgery is done very commonly. It's a very safe procedure, but some of the risks include excessive nasal bleeding. And so everybody's going to bleed some, but some people can have heavy bleeding. If there's heavy bleeding that doesn't slow or stop, then they may need to go to the emergency room over that. It may not be a bad idea to have on hand some Afrin or oxymetazoline nasal spray. Sometimes a couple squirts of that, if people are having excessive bleeding, can slow the bleeding and maybe help it stop and keep them out of the emergency room during that healing period. The other risks of sinus surgery is rare, but we work around the eyes and the brain, and although extremely rare, there's a chance of spinal fluid leaks, meningitis, blindness, double vision, or injury to the tear ducts that drain from the eyes down through the nose. If a septoplasty is done with the surgery, then you have additional risks of having changes to the outward appearance of the nose, or having a septal perforation, which can cause a whistling sound when you breathe, or excessive nasal crusting that's hard to heal. If people are having any of these complications or problems, then there's a doctor on call 24/7. We can always be reached at 803-936-7530. And there's always someone available through the main hospital's emergency room to manage any kind of issues or problems that can happen. So, hope that helps. The sinus surgery is going to be most likely very helpful in improving your nasal symptoms, and we're always here to help in any way during the healing period. Thank you.